Dr. Kelly, a very good afternoon to you, and thank you so much for your time. So, in the main, this report has found that South Africa's air quality fails to meet the World Health Organization standards, with some of the key findings and the key polluters identified in the electricity sector, especially when you look at companies like Eskom. Speak to us about where we are falling short as the country the most.
Yeah, so the levels of air pollution, specifically PM2.5, these toxic particles, can reach around 10 times higher than the value that is set to be safe. And this is set by the World Health Organization. And when it comes to PM2.5 in South Africa, it's impossible to avoid also talking about coal use and specifically Eskom.
So where are we in terms of the actual numbers? I mean, when we look at the significant impact it has on health and economic, impacts. I'm looking at your report. I want us to talk about the deadly impact, first of all, particularly when you start looking at, the rate in which PM25 is causing deaths, 42,000 in 2023, including, of course, which is of concern, over 1,000 children under the age of 5 years old.
Yeah, so PM2.5 is one of the most deadliest pollutants that are known. And once it's inhaled by humans, it can actually penetrate the lungs and enter the blood system, where it has nearly negative impacts on nearly all of the major organs and systems of the body. And so that 42,000 deaths that are occurring in South Africa each year, these are through things such as heart disease, dementia, stroke, diabetes, and lung cancer. And of course, in children, which is especially tragic considering they are innocent, they didn't contribute to this issue, they're just about to start their lives, but their lives are being cut short due to lower respiratory infections.
And the impact economically, what does that mean, particularly when you start looking at recommendations like just transitioning?
Yeah, so the impacts are colossal. It's through things like missing a day of work, going to the emergency room due to asthma, and of course also dying prematurely. It means that you can't contribute to the economy. And when we add up the economic cost of all of these different impacts, it reaches almost 1 trillion rand every single year. And to put this into perspective, this equates to roughly 14% of the GDP. And when we think about the just transition and phasing out fossil fuels, traditionally people think that this is going to be benefiting climate in maybe decades to come. But when you look at it through the air pollution angle, it means that phasing out fossil fuels doesn't only prevent us from dangerous climate change in the centuries to come, but it also leads to public health benefits now.
So the evidence is there, the scientific evidence, according to your report. Maybe speak to us then about, just some of the key recommendations, especially when you look at these key polluters. What are the recommendations that speak to accountability, for one, as well as, future-proofing air pollution in this country?
Yep. So, firstly, if you really want to solve the issue, then you can cut out these emissions, and that's by transitioning away from fossil fuels that are really polluting to clean, renewable sources of energy. Failing that, or at least in the medium term, what these emitters can be doing is installing technology that can at least limit the amount of pollution that are coming out of power plants and steel facilities. And while that is what these power companies and industries should be doing, in particularly Eskom are kind of doing the opposite, and they are repeatedly asking the government for actually exemptions from these very policies that are actually limiting emissions and trying to protect human health. And also, these companies should be people like Eskom they're also actually keep on delaying when they're going to be decommissioning their coal-fired power plants.
And I mean, at the top of my mind, from a governance perspective, why has, Eskom then been allowed to transgress, some of and breach just some of these targets that have been set by the WHO, do you think?
We often analyze the exemption requests that ESCOM make, and we find that they oftentimes minimize the impacts that these exemptions are going to have. They downplay the impacts that this is going to have on human health, and for some reason, this convinces the government to allow them to have these exemptions.
And just in terms of the key recommendations, what would a successful just transition look like in regions, especially like Gauteng and Mpumalanga, where some of these operations are?
Yep. So transitioning away from fossil fuels is obviously going to be very challenging, and it's important to do that whilst ensuring that the communities that are already disadvantaged aren't made even worse off. But there definitely are tried and proven ways to do this. For example, especially in South Africa, there is huge potential for solar panels, solar generation. And in the long term, this can actually prove really economically viable, both for the state and also local communities. And to keep it just, we really need to see the governments transitioning away whilst thinking about these disadvantaged communities.
Dr. Kelly, thank you so much for your time this afternoon. Really do appreciate it. Dr. Jamie Kelly, Health Impact Assessment Team Lead at the Center for Research on Energy and Clean Air, of course, together with Greenpeace. They then have released this particular report that is quite concerning, speaking about South Africa's air quality, which is failing to meet the WHO organization's standards.